Thank you to everyone for joining us for this Q&A session about the third annual Breast Cancer Deadline 2020 Progress Report. I'm going to give a very brief overview of the report, and then we have a number of questions that were submitted in advance as we had requested, and I'll get to those in a moment. But first, I think it's important to give some background information and a very short summary. So as a background, you'll recall when we launched the Deadline campaign in 2010, we made a promise that each year we would report on the state of breast cancer and where we are, where the National Breast Cancer Coalition is in our work to achieve the goal. And we pledged to be accountable and transparent, and of course the Deadline progress report is part of fulfilling that pledge. We've issued annual reports since 2011. This is the third. The report in 2011 is the baseline status report, and all subsequent reports really need to refer back to the baseline report. That was an overview of the state of breast cancer at that time and described our initial efforts to refocus action toward knowing how to end the disease by 2020. The 2012 report was an update from the year before, and we had some additional analysis of current research priorities as demonstrated by research funding and the breast cancer conversation in the media. And now the 2013 report will update with information from the past year. Now, I hope you've all read the report, but I just want to provide you with the NBCC advocate perspective on what we reported. If you haven't yet read Section 7 of the report, which is the advocate perspective, I believe it provides a helpful understanding of the state of progress in breast cancer. And here are just some of our observations. You know, it's important to put our report in the context of our mission. There are progress reports that are issued by a number of different entities from different perspectives. We certainly have reports issued by the trade associations for oncologists and for scientists such as ASCO and AACR. They will view and report on progress quite differently from a patient advocacy group like the National Breast Cancer Coalition. You know, as advocates, our mission is to end breast cancer, to save lives. And that is the lens through which we look at the state of breast cancer. We don't look at it through how much money has been given to the scientific community or how many patents or how many publications. We really look at it through the lens of our mission to end breast cancer. And when we do that, the results are certainly continue to be disappointing, although we believe there has been some progress, and I'll talk a bit about that. But you'll see from the report that the incidence and mortality rates have not dropped significantly. Now, the rate of decrease in mortality seems to be slowing rather than increasing. So we know over the past number of years, the mortality rate has decreased. And for a while, it was decreasing at over 2% a year. It seems to have leveled off at about 1.9% a year and maybe even less than that. So that shows us that the rate of decrease is slowing. And if we had made and continued to make significant progress, that is not what you would see. You would see, in fact, the opposite of that. So that is a disappointment. Again, while we're happy that the rate has decreased, we're not happy by the amount of the decrease or the rate at the moment. Now, we also talk a bit about screening, and we know as advocates that the point of screening is to save lives. But the conversation has turned the focus to finding more cancer and finding pre-cancer and finding everything we can earlier. Now, if the same women who were screened die at the same time they would have without screening, as we all know, finding their cancer early is not success. And in fact, it can be a major step back because we've now subjected those women to toxic treatments that may have lifelong effects or even take their lives. So they're not getting any benefit from screening or from treatment, but they are getting harm. They are suffering from the toxicities. And new data that was published over the past year that we discuss in the progress report demonstrated even more vividly how misplaced that emphasis is. We have the incidence of late-stage disease has decreased only slightly, and the incidence of metastatic breast cancer at diagnosis did not change at all, despite the increase in screening. And more data continue to be collected regarding the magnitude of overdiagnosis due to screening and the resulting harms. And one study that we discussed in the report estimates that the rate of overdiagnosis from screening to be between 15 and 25%. And there is another estimate that for every breast cancer death avoided from screening, an additional 1 to 3 deaths can be expected as a result of radiotherapy for those overdiagnosed because of their increased risk of dying of heart disease and lung cancer. And again, we explain that report in our progress report. But I think when we talk about the toxicities and the decrease in the mortality rate, we have to put it in that context also, because the decreased mortality rate is reported for breast cancer deaths, and it does not take into effect deaths from treatment for breast cancer. In treatments, as you know, we are looking for treatments that prolong life or significantly increase quality of life with minimal risk. And we've seen a push to have more and more drugs approved on surrogate endpoints. So too often progress is defined by new treatments that neither prolong or significantly increase quality of life with minimal risk. In the past year, the FDA approved 3 drugs for the treatment of metastatic breast cancer, with only one of the drugs showing an improvement in overall survival. And again, we describe that in much more detail in the report, and we also have a box in the report that explains what surrogate endpoints are, so that the public, when they are looking at reports of drugs being approved, they can put it in the context of what, quote, benefit those drugs actually provide. But now we do see some promise that the tide is turning as more of the breast cancer community is focusing on the breast cancer deadline goals. And publications during the past year of the studies I mentioned that examined the benefits and harms of screening gave rise to some balanced media coverage about those issues, more balanced than it had been in the past. In addition, we've seen progress in terms of how research funding is allocated, and as we detail in Section 5 of the progress report, the percentage of public funding for research into metastatic breast cancer by both the NCI and the Department of Defense has increased significantly over the past 2 years. However, the figures for research into primary prevention have not. They remain troubling. At the same time, we've noted that there has been a movement in research toward more innovative ideas. We see that in proposals funded by the DoD PCRP, especially in response to the Breakthrough Award mechanism, and programs at NCI such as the Provocative Questions Project. The National Breast Cancer Coalition's efforts to change the conversation in breast cancer have also begun to bear fruit, but we must continue implementing the blueprint. And you can read more about the work we've accomplished in the past year in Section 8 of the progress report. You know, very recently, within the past week, I spoke at a medical institution, a research institution, about progress in breast cancer from a patient perspective. And I had the opportunity to sit down with about 25 of the leaders in that institution in science and healthcare. And I asked them why they invited me to speak rather than a doctor or a researcher. And they told me it was very important to them to hear from a patient perspective what we perceive as progress. And they told me that they were well aware of our deadline campaign, and they talk about it often. And when they talk about setting priorities and doing their research, they talk about it in the context of the deadline campaign. Now, you're not going to read that in the New York Times or anyplace else, actually, but that is what's happening, because that is not the first time I've heard that from scientists and researchers across the country. So it is exciting to us that there actually is progress, there is a change in the conversation, and that is happening more frequently than it has been in the past. Again, that is a very brief overview of some of the highlights of the progress report, and I hope you'll take the opportunity to read all of it. But I wanted to be able to address the questions that were submitted ahead of time, and there were, again, quite a number of them. So let me begin. I have a question from Sandy in California, that one of the messages in the report that seems to have melted into the text is that we're predicting that at the current pace of research and treatment, we will be able to prevent and cure breast cancer in 2 centuries. And Sandy wanted me to talk a bit more about that. And as I mentioned, and as is in the report, the mortality rate is declining, but it's doing so at a relatively slow rate, less than 2% a year. And as I mentioned, that rate is decreasing, meaning that the mortality rate is declining even more slowly. So we actually set up a mathematical model with a roughly 2% reduction per year. And when you do that, it takes centuries before you really get close to eliminating the disease. Breast cancer and mortality in 2010 was 21.9 deaths per 100,000 women. To get that down to 1 death per 100,000 women would take about 150 years at the current rate. And that would still leave thousands of United States women dying each year from breast cancer. That's U.S. alone. And, of course, that's why we launched the deadline, to bring back the urgency and to push people from just accepting that status quo. So, yes, it is a message that we hope will get out there even more. We have a question from Bobbi in Ohio. What is the focus, and is there any progression on preventing this disease? Every organization seems to be focusing on treatment rather than obliteration. And, of course, our response is that is very much the message of Breast Cancer Deadline 2020. The goal needs to be preventing breast cancer and saving lives. And as the progress report details, there are so many toxicities associated with the treatment itself. And although we've made some small advances in treatment, they haven't changed the incidence and mortality figures as much as you'd expect, with all of the billions of dollars and other resources devoted to the efforts. And that's why we are focused on looking at primary prevention as one of the main areas of focus for the Deadline campaign, and at the moment focusing primarily on a preventive vaccine approach and also ways to prevent metastasis by studying tumor dormancy. So we have made progress on the preventive vaccine work that we're doing, and that is reported in some detail in the progress report. I have a question from Lisa in Virginia that a study reported on October 8th in the journal Nature Communications appears to have disproved the theory that there is a viral cause for breast cancer, among other cancers. And what relevance, if any, does this have for the ongoing Artemis vaccine project, or perhaps for part of it? Well, our investigators are currently evaluating that paper, and a preliminary response is that the work reported in Nature does not definitively rule out an association between a pathogen and breast cancer, as viruses can do a hit and run. So they may have an impact on cancer development and still not show up later in cancer cells. However, the majority of our project is not focused on there being an association between breast cancer and a virus. We're primarily focused on finding the proteins that show up as cancer develops that are not expressed in normal cells. And we already have some early results from that work. We have a list of about 200 possible vaccine targets that we are working on evaluating. And we have a number of advocate projects evaluating and prioritizing known possible targets for the vaccine. So it is a very interesting paper, and as soon as we have more information and more analysis on it, we will make that available to you. The next question is from Norma in Virginia. And that question is the therapy that extracts white stem cells and programs them to attract and kill the cancer cells effective for breast cancer? And our answer is that we do not have evidence that this procedure is effective in breast cancer, but as part of our Artemis projects, we're working with a number of immunologists who bring very different expertise and perspectives to the table. So in our work on the vaccine and in looking at tumor dormancy and other issues around the immune system, we're researching therapies and theories such as this one to see what merits further investigation and support. Then I have a question from Ginny, and that is actually two questions. So the first question is that in the report we refer to the common scientific outline coding of research and mention that Komen and other private funders no longer use this. And the question is, are they using their own system? Or is there another recognized classification used? Susan G. Komen does not have any coding of research on their website, but you can see recent graphs on their website with abstracts and the level of funding and other information. They're simply not categorized by CSO or any other coding mechanism. Ginny's second question was that she wanted to confirm the statistics on increases in metastasis funding are based on analyzing the CSO category 1.4, biology, cancer, progression, and metastasis. And that is correct. Our analysis was we looked at research coded as cancer progression and metastasis. The number for the DoD program was over 40%, and that is over 40% of the total awards, not just the awards in coded as biology. The next part of that question from Ginny is in terms of primary prevention. We do not quote numbers this year. That is correct. The numbers haven't changed significantly from last year. But we looked at the category of the CSO for prevention, all of prevention, not just that coded under vaccines. The specific numbers for NCI can be found on their website under, fundedresearch.cancer.gov. And, of course, we report numbers for NCI and also for the DoD program. Another question that was submitted by CJ is a question about our support for a position on research into helping women whose disease have already metastasized. I'm not sure exactly what that question is, but I will say that our position concerning research focused on already metastasized breast cancer is, what it has always been. We strongly support increasing research in that area, and as you will see from the DoD program, we've all been pretty successful in helping make that happen. We are also doing analysis to see not just how many dollars are associated with research into that area, but we are looking more deeply into what's been funded to look specifically at what questions in metastatic research are being addressed and who is doing that. In addition, we are working on this year 2 clinical trials in metastatic disease, one on a PARP inhibitor and another on a CDK inhibitor, and we have made those 2 our clinical trials projects for this year. In addition to the ongoing work that we do with Project Lead and other education and training programs to enable advocates to collaborate with scientists to set priorities for research. Another question that we have is from Sheila in Pennsylvania. How is the money that has been collected so far being allocated? Are these funds being used to help women that do not have insurance for breast cancer treatment? So I'm not sure if Sheila is talking about donations to NBCC or breast cancer funds in general, but I will say, as noted in the progress report, there are thousands, if not tens of thousands, of breast cancer organizations, and quite a few do help women who do not have insurance for breast cancer treatment. We, of course, at the National Breast Cancer Coalition were the force behind the Breast and Cervical Cancer Treatment Act, passed by Congress to ensure that women who are uninsured or underinsured who are screened through government funding screening programs also have access to treatment. And in addition, we worked very hard on the Affordable Care Act to expand access to care for all individuals who do not have insurance, and to make certain that pre-existing conditions are not a barrier to their obtaining treatment. Well, that's the kind of system change that we work for, influencing public officials and other leaders to ensure systemic access to quality health care and continued funding for innovative breast cancer research. The last question that was submitted was from Claudia in New Jersey. And this, I have to say, is my favorite question. The question is, what can I do to help? How can I make this a priority, and how can I help achieve your goals of identifying a preventive measure for breast cancer by 2020? So one of the reasons we publish the progress report each year is to help educate the general public about the reality of breast cancer because, as we say, the reality is troubling. But as I've said before also, breast cancer advocates have already accomplished things that others thought were impossible. Nearly $3 billion more for breast cancer research, advocates playing a role in research design and funding decisions, and those are just two of many examples of which all of you are aware. But we're not going to reach our goal without more people behind it. So I hope that Claudia and others will share the progress report with others you know, and follow us on Facebook and Twitter, share our posts with others in your network, and get more involved in our efforts. We're holding our second Advocate Leadership Summit in May, and we need more of you to step up and join us as leaders in the movement. Go to our website and register now for the summit. And Claudia asked specifically about the preventive work we're doing. We now have a crowdfunding campaign on Rocket Hub to raise money for this work. And we'd ask you to tell others you know to help us reach our funding goal. And if you go to the Rocket Hub website and search for breast cancer, you'll see our campaign for the Artemis Project on a preventive vaccine. Those were all of the questions around the progress report that were submitted in advance. And I want to thank you all very much for participating in the call. And I really appreciate all the support you've given for our work, and I ask that you continue to spread the word about the progress report and specifically and hopefully help with the Rocket Hub funding campaign. Thank you very much.